one day I said, you want to join us in prayer? You want to join us, Dr. Zitter?
Definitely.
And she did.
The Chaplain and the Doctor is the latest documentary from California-based physician Jessica Zitter. Dr. Zitter started her career in critical care in ICUs and emergency rooms before moving to palliative care. That's a specialty that focuses on helping a person live as fully as possible with a life-limiting illness. The film explores her friendship with Betty Clark, an older Black female chaplain. You're caring for the body, they're trying to care for the spirit. But do you find that some patients, when they see the chaplain come in, they think, "Oh, I don't need this. I'm not heading toward the end right now." So, what's that relationship like?
It's very, very common that this happens. That's why so many palliative care chaplains are starting to call themselves spiritual care, because it really is about spiritual care. And Betty talks about this so frequently. She says the role of a chaplain is not to be Bible thumping. It's not about connecting only over religion. Many people are not religious. It's about connecting through the spirit, and every single person has a spirit. You could call yourself an atheist. You could be a total atheist. You have a spirit. Betty talks about a patient who is like, I don't need you here. I'm not religious. And she said, oh, no problem. And she started saying, well, just, can you tell me what gives your life meaning and purpose? And he said, my Harley. And so she spent a bunch of time just talking and asking him about his Harley Davidson. And that was a very powerful experience for him. He just kind of came out of his shell and felt a lot more empowered.
Can you explain the role of spirituality, or how we look at our lives through a spiritual lens, especially as we start looking toward the end of our lives? How does that play a role in palliative care?
I think when somebody is living their regular life outside of the hospital, there's more touch points with your humanity, with your own personal humanity. You may have friends and family, you may have interests and things that you're doing. Once people start to become ill and they start to have less functionality, and then particularly when they come into the hospital ill, they really not only don't have those touch points with their own self and their own memory of themselves as a person, a full-bodied person, but people don't see them as full-bodied people. We see them as the patient with this kidney problem, that liver problem in that room. And I think that this is just bringing the fabric of people's lives back into the hospital is an extremely therapeutic act.
I know from my physician friends, Dr. Zitter, that being a doctor can be kind of scary at times. There's a lot of pressure to be perfect. People put you on a pedestal. And I'm wondering, how did Miss Betty crack your armor?
Well, it really was a shocker. I was sort of living in this hierarchical world where the doctor's at the top and the chaplain is a nice to have. And Betty, one day, after us working together for about 3 years in a 15-year total relationship, essentially accused me of bias and maybe even racism in a conversation that we were having about a patient. And that really got my attention. It was basically about a patient who had come in, a young Black man who had had a gunshot wound. And it wasn't just me, it was the whole team of white healthcare providers who were calling him a gangbanger. And Betty looked at us and said, that's racist. You don't even know this man. And it turned out we did not know this man. He was a post office worker who lived with his grandmother who had been shot at random on the highway. And, even if he had been a criminal and got shot, this man would still have a life. But it made me just really take note of how much we attribute personality types and all sorts of things to somebody based on a few superficial things. And I just couldn't stop seeing it. Once I started noticing it, I saw it everywhere.
So what do you want people who view the film to take away when it comes to that particular issue?
Most importantly, I want people to see it all around them. I want people to understand that implicit bias is a human and natural part of the way our brains work, and not to berate themselves, but to notice it, and hopefully to notice it in their own selves. And I hope that will move people into the kind of place I've been moved.
Folks like Chaplain Betty are really good at getting someone's story. That was clear watching the movie. She's got a knack for that. And I'm wondering, because you say that some providers make snap judgments on patients without really knowing their story, how does that kind of storytelling, how does knowing one's story help that patient-provider relationship?
It's really everything. I mean, if you start to see a person as more than a two-dimensional being, you start to really find areas where you can connect with them, where you can find similarities and belonging with them. And it just makes all the difference. And I do think that chaplains and social workers are kind of trained to pull people's stories out. And I think we can all do so much better. And the times that I have been by Betty's side, and that is obviously increasing over the 15 years, we now work together extremely frequently. I'm always surprised by what I miss, and I just always feel this excitement about being able to do better.
I wonder how, again, knowing someone's story helps in the healing process. Does that make sense?
100%. I mean, 100%. And it's a two-way situation because, first of all, if a person's coming in their most vulnerable moments and they feel that the person's sort of standing at the bedside or sitting on the bed next to them really cares about them and is curious about their experience and is curious about them as a human being, there is something extremely therapeutic about that. And I mean, I think that's true in life in general, but it's particularly important in moments when somebody is as vulnerable as people are when they're sick. Well, I mean, and the opposite is true. It's also the healthcare provider to have this establish this relationship with a person that they're caring for makes us feel more like human beings as opposed to these, as you said in the beginning, knowing everything superheroes, which we are not, and we know we're not on some level.
You're one of only a handful of working physicians who have gotten into filmmaking. What's the attraction for you?
So funny. I have always been a storyteller. I think that telling stories really, number one, is therapeutic for me. It helps me process all of the emotions of this incredibly challenging work. And also, I think people resonate in hearing my story when I bring it to other people. A lot of people who wouldn't necessarily be putting their stories out there say, oh my gosh, that's my experience too. And I think it helps them and it brings community. I feel communal connection with those people once we have that story in common. And I was a writer, wrote a lot, in the New York Times, and I wrote a book called Extreme Measures. And then I saw a film that was filmed in our hospital, and I saw how powerful it was and how gripping it was. And I realized I could write 50 books, but showing it one time on a screen is going to grip people.
How do you hope your filmmaking maybe changes how we do medicine in this country? And maybe change, because you are a palliative care physician, change how we do death and dying in this country? Two different questions there, perhaps.
No, they're kind of related questions. I think that when people can see themselves, when the people with the biggest leverage around this are, frankly, doctors, right? And they're the ones who there is this hierarchy in hospitals, and doctors are kind of, as they say, blank rolls downhill. So if you're trained to see yourself as at the top of a heap, and you're kind of at the top of this hierarchy in this space, I think that there's a lot of leverage for change. And so what I really care about everybody seeing this film, nurses, social workers, and non-healthcare professionals, but I really would like to see medical students, medical trainees, and physicians see this film and be able to watch on a screen something that isn't a direct attack on them, but that they can see another person wrestling with some of the same things that are part of what we wrestle with, even if we're not consciously. And to be able to look at it in a non-threatening way on a screen, someone else, can help people kind of start to come into a conversation and start to say, let me think about that. That touches something in me. That resonates with me. And then to take away some of the shame around it and to open it up as a conversation and hopefully to start to raise awareness and start to move our culture in a different way.
Being a filmmaker expanded your view of what's possible for you?
That's a great question. I think that there is such a power in storytelling, and you can envision being the person you want to be. When you have this blank slate or a film or something in front of you, you can start to play out, well, I would do this differently and I would do that differently. And you can start to imagine a more idealized version of who you want to be. And so I really believe, not only for me, but for the people who watch these stories, that there's just a way for us to envision a better world, a better healthcare world.